All right, so there's a lot of things that can go wrong with the endocrine system. We're just going to touch on a couple of these. So thyroid-related diseases, the first is something called a goiter, and you can see that on this individual in this image. This is a type of hyperthyroidism. So what's going on in a specific one due to iodine deficiency. So basically, those thyroid hormones, the T3 and T4, they need iodine. It's one of the building blocks of both of them. If you don't have enough iodine, you cannot make thyroid hormones. So what happens here is that the person has an iodine deficiency. So basically the thyroid gland goes, well, why am I not producing enough thyroid hormones for the body? It must be because I'm not big enough. And then it keeps growing and growing and growing, trying to do its job. However, it can't because it simply doesn't have the building block, but it doesn't know that. So you end up with this very large goiter or growth in the throat. Now, we don't see this very often in the United States anymore. This is because we have iodized salt. So you may have heard of that. That is not a bad thing. You put iodine in salt, and we have a fairly salty diet. So we supplement our diets that way with iodine, right? For proper thyroid production of hormones. These days, Graves' disease is a much more common form of hyperthyroidism, and whereas the thyroid gland still can be enlarged, it is not going to be nearly the same type of goiter that you see here. It's just an enlarged, diffuse one. So you may have like a slight increase or swelling in the throat area, but again, it's not this enormous growth. In this case, it's hyperthyroidism, not because of any kind of an iodine deficiency or anything, but simply the thyroid gland is now producing too much of the T4. Okay. And you can see one of the classic sort of indications of that is these sort of like these eyes that are somewhat bulging out of the eye sockets. A lot of times there's a heat intolerance and also an anxiety that goes along with that as far as behavioral kinds of symptoms of Graves' disease. As far as hypothyroidism, there's one that's congenital. So this is basically a nutritional deficiency of iodine in utero and early on in development, so that growth, including physical, like body growth, as well as mental growth, is stunted. So in this case, that deficiency of iodine, again, because it's so very early on in development, not later on as an adult, that there's an actual, the child's body does not grow properly, and nor does their brain. And then probably more common these days is, as far as like the type of hypothyroidism, if it's going to happen, is something called Hashimoto's thyroidism. And this is an autoimmune disease, meaning that the immune system attacks the thyroid gland. It just starts seeing it as not part of the body, so it attacks it, eventually destroying it. And then you have too little thyroid hormones being produced. And a lot of times people have to go on supplements to supplement that. As far as adrenal diseases go, one will have kind of, again, opposing ones. The first is Cushing's syndrome, and this is due to too high levels of cortisol. And I don't necessarily expect you to remember all of these things, but just be aware this is what Cushing's syndrome is. It results from very high cortisol levels. And either this is because there's a tumor in the pituitary gland that's causing too much of that ACTH to be produced, and too much of that ACTH goes on to affect the adrenal gland, making it release way too much cortisol. Or the problem is at the adrenal level itself, like you're producing the right levels of ACTH, but the adrenal gland has a tumor and is producing too much cortisol. Now, if you remember back to the things that cortisol did, if you're producing too much of it, you're going to have high blood pressure, high sugar levels, a suppressed immune system. It can definitely affect the immune system or even reallocate it. You can even get to the point of where the body becomes insulin resistant. It can also affect, person's libido, sex hormone levels. It can even go back to affect the thyroid hormones being released. And then that causes changes in the body. And this individual, I don't know how well you can see this, but this is a very old picture. It's one of the very first images of someone with Cushing's syndrome being diagnosed of it. And back in the day, they were not very kind with some of the terminology they gave people. But people who have Cushing's syndrome tend to have like this very round red face, weakness and thin limbs. So you'll notice how thin her arms and legs are compared to her midsection. There's sort of this telltale kind of growth of, or I should say like a deposition of fat, kind of like right behind the neck. And then there's, because of that kind of reallocation of fat to like the midsection, oftentimes there's very quick growth, which causes stretch marks over the abdominal region. Now, the exact opposite of Cushing's syndrome, which is too high levels of cortisol, is Addison's disease, and that's having too little cortisol and usually mineralocorticoids as well to go along with that. Now, the causes here can either be there's no adrenal glands, so you don't have enough to produce. It doesn't form properly developmentally, and so you can't produce cortisol, mineralocorticoids, or for some reason they're not functioning properly. One of the classic telltale marks is a bronze coloring of the skin. Now, this individual, I mean, obviously this is one of those images where it's been manipulated to kind of show you what bronzing of the skin would look like. So you can see on this side, the individual has sort of normal colored skin. If they had Addison's disease, that's what it kind of looks like. It's like an abnormal tan color, like you wouldn't tan that color like naturally if you're out in the sun. It's this weird bronzy kind of color to the skin. Some of the symptoms are low blood pressure, so exactly the opposite. It's like low blood pressure, hypoglycemia. Because of the low blood pressure and hypoglycemia, sometimes there's confusion, some problems with cognitive functions, behavioral functions, obviously lethargy, so you're very tired all the time. That's not very surprising. And it can even disrupt the digestive tract, leading to vomiting and diarrhea. One of them, I mean, none of these are particularly pleasant or helpful in trying to just navigate everyday life. But one of the other, I guess, main life-threatening crises here is that because people cannot maintain proper blood pressure, if they are in an accident, they really have a major drop in blood pressure, which can then make them go into shock. My apologies for that. That was my dog barking. So again, they will go into shock, meaning they can't maintain their blood pressure, which means that many of their organs could fail, and it's very easy for them to die due to some sort of a trauma. All right. And after this, we're going to start transitioning into the next section. We're going to talk about androgenic hormones, and again, that kind of section, will transition us into how hormones can play into gender, proper development of reproductive organs, and then, how individuals then present. So we'll talk a little bit more about that in the next video.